Hey, welcome to the program. Good to have you along with us here. And Dr. KG and Lucas is with us in the studio. Good morning.
Good morning.
What are we talking about today?
Cirrhosis.
Cirrhosis of the liver.
Yes.
Or does it affect anything else? I mean, cirrhosis. We always say cirrhosis of the liver, and I just wondered, is there anything else?
We only use it to describe the liver. A cirrhosis is just excessive fibrosis.
Oh,
So
okay.
you can get anything that gets scarred up, but somehow cirrhosis has only been associated with the liver, and it's only really been associated with alcoholic liver disease, which is not true. That fibrosis of the liver can be caused by any kind of disease that affects the liver. It's just fibrosis related to inflammation.
So you actually have a category that's non-alcoholic related, right?
Right, it's NASH, non-alcoholic steatohepatitis. ASH, I guess, would be alcoholic steatohepatitis because alcohol causes fatty liver. Fatty liver can cause inflammation. Inflammation can cause scarring. It's just like anytime you cut yourself and it gets infected and you can get a scar from that, or you have surgery and that causes scar tissue in that area that's been irritated. So if the liver's been irritated, it can develop scar tissue in the liver. And
Okay.
I think people have cirrhosis, but they never drink alcohol, and that's what it's from. It's probably from fatty liver, because fatty liver is associated with, insulin resistance and diabetes and central fat.
So is this a chicken and the egg kind of thing? Does one come before the other? Or?
They don't know what causes fatty liver, because not everyone that's overweight and has diabetes has fatty liver, but 50% do. People that are overweight in the middle or have insulin resistance, diabetes, have 50% of those people have fatty liver. So that's why it's so common. But the cirrhosis part is less common, thank goodness. Only about 20% of those people that get fatty liver get scar tissue in the liver, and only a small percentage of those go on to get cirrhosis from that. But it can happen. It's more a genetic component, as well as the diabetes being out of control, or high triglycerides being out of control, or weight being out of control. Those contribute to it. Alcohol causes fat to be deposited in the liver, so that's the other mechanism for alcohol. It's also fatty liver. It's through fatty liver.
So again, it's a combination of genetics and choices
Yes.
that make up these.
Like
these
everything
issues.
is.
Yeah.
Everything.
Really. But you study this. I mean, is this something that's been studied for a long time in terms of relationship to diabetes, or is it relatively new to be doing this?
Well, I think the reason it's become a little bit more talked about is there are actually medicines that are trying to improve it. So in the past, there were really no medicines for cirrhosis other than medicines for some of the side effects of cirrhosis. But now they're trying to find medicines that help reverse the fibrosis and improve it. So I don't know if they'll be successful, but at least there's about 34 different compounds being developed now for fatty liver and for fibrosis. So they're hoping some of them will help people that have cirrhosis.
I think fatty liver for a long time was just, if you were diagnosed with it, the common assumption was that you were drinking a lot.
Well, or that you were overweight. They would just tell you to lose weight, fatty liver will get better. But that's not necessarily true. But it does help, of course. And it depends on if you have any scar tissue or not. We have a machine in the office that can detect whether you have scar tissue in your liver or just fat. Just fat doesn't necessarily lead to cirrhosis. You don't know if that's ever going to happen if you have fatty liver. But a lot of people with fatty liver for years, it just stays there. It doesn't do anything. It doesn't cause inflammation. And that's when you get inflammation is when you get the fibrosis, the scar tissue in the liver. And it's not good to have scar tissue in any organ. The liver can regenerate a lot of times if you give it a chance, but over time, if the fibrosis starts, it continues. So that's what they're trying to work on to try to improve that.
To use a popular phrase, is there a tipping point when it cannot regenerate any longer?
Probably.
Probably. Yeah. It just seems like there are for some folks, it's gone too far.
Well, I think once you start having so much scar tissue that you have side effects, and you start having liver dysfunction. So when the liver doesn't work, since the liver does a lot of things, it makes a lot of proteins and clotting factors and makes cholesterol. So if it doesn't work, it can't make enough proteins to keep fluids inside the blood vessels. So it leaks out. You can have fluid in your abdomen. You can have swollen legs. If it doesn't make enough clotting factors, you can have bruising and bleeding. If the blood vessels in the liver are blocked by the scar tissue and you have backup of that blood flow, it backs up into the blood vessels in the stomach and esophagus, gets real dilated veins like varicose veins, which can bleed. So anytime you've had any of those side effects, then it's a little bit far gone, although one of the studies for cirrhosis that we have wants people that have had either ascites, which is that fluid in the abdomen, or bleeding from the esophageal, called varices or varicose veins in the esophagus.
So it's a pretty advanced stage.
That's a pretty advanced stage. That would be before liver transplant. So they want people that are have those side effects to see if that gets better. So that's one study. The other study doesn't want them to have any side effects from cirrhosis. They just want them to have cirrhosis, and they prove cirrhosis by liver biopsy, which is a small needle inserted into the liver. They get a core tissue and look at it under the microscope, and certain amounts of fibrous tissue and cell death in the liver leads to the diagnosis of cirrhosis by liver biopsy.
Are there any symptoms of cirrhosis that come early enough to then ward off some of these things?
No, and that's what's a little scary about the whole situation, because since we've got this FibroScan, which detects this more severe liver diseases better, once it's pretty bad on the FibroScan, I mean, these people have no symptoms. They're just walking along, and they've been told they have fatty liver, so we do the FibroScan and find out they have cirrhosis already, and they didn't know that, and there's no symptom of it. The only symptoms if it's really far advanced. And so that's why one study is pretty far advanced. One study doesn't want you to have a lot of side effects from cirrhosis. They just want to see if they can prevent it from getting worse or actually make it better.
So someone diagnosed with fatty liver, you're trying to do things so they can take actions now that prevent them.
And even if they're on the placebo, we're still working on their diabetes and high triglycerides and weight, during the study. So that's why they have to have a placebo group, because some people get better on their own. We've had people even not qualify for the study by the time they get ready to be in the study, because they've already lost weight and got their diabetes controlled, and their liver got better. And so you can measure the improvement with the FibroScan also. It's just like an ultrasound. It's a pulse of sound through the liver.
All right, we'll have more to come in a moment with Dr. K. Jane Lucas and Sugar Talk. If you'd like to call in with a question, 800-818-2255, or you can call these local numbers,
247-7282 or 353-4674.